Hi, I'm Skylar, and today I'll be talking about the health benefits of a vegan and vegetarian lifestyle. So, there are many people who believe that there's only one kind of vegetarian or vegan, but this isn't true. And while there are many types, I'm just going to list the most important ones. For starters, there's lacto-vegetarians, and these are vegetarians who consume dairy products and plant foods, but not eggs. There are also lacto-ovo-vegetarians, and these are people who consume eggs, dairy products, and plant foods. And there are also pesco-vegetarians, and these are people who eat fish in addition to eating plant foods, dairy products, and eggs. And then there's the vegan, who consumes only plant foods and no animal products at all. And while many people believe that people switch to this lifestyle just because they are concerned about the welfare of animals, this is not the case. There's also many health benefits behind becoming a vegan or vegetarian. For starters, one health benefit would be a vegan diet is richer in certain nutrients. And this is because when one eliminates meat and animal products, they take in replacements of whole grains, vegetables, beans, peas, nuts, and seeds. And these changes contribute to a higher daily intake of beneficial nutrients such as fiber, folic acid, vitamin C, vitamin E, potassium, magnesium, and have a fat concentrate that is more unsaturated. In a study done by the Epic Oxford, they provided the largest sample of vegan dieters worldwide, and it showed that a higher intake of fiber, magnesium, iron, folic acid, vitamin B1, C, and E, they have higher levels of them in vegans compared to omnivore dieters. It also shows that vegans and vegetarians are more likely to have a lower body mass index and lower bad cholesterol and blood pressure. And these are all associated with longevity, and it reduces risk for many chronic diseases. Another reason why people might switch to a vegan or vegetarian lifestyle is because vegan diets help lose excess weight. And this is because when one stops eating red meat and animal products, it slows down digestion and improves lipid control. Studies have shown beneficial effects of plant-based diets, and they show lower weight status, better glucose, insulin, plasma lipids, and inflammatory markers. And the reason it shows lower systematic inflammation too is because in plant-based diets, there is an abundance of anti-inflammatory molecules, and when they take those to avoid pro-inflammatory animal-derived molecules, it helps lose the excess weight. Research done by Lawrence A. David and colleagues show that people on a vegan diet tend to also have a healthier gut microbiome, and this is a collection of good bacteria that live in the digestive tract. So when one eats a lot of red meat or animal products, it causes us to have the bad bacteria in our digestive tract, which causes us to gain more weight. In another study by Dr. Lee, he found that people on a vegan or vegetarian lifestyle had a larger reduction of HbA1c and lower waist circumference compared to non-conventional dieting, compared to people who eat red meat or animal products. And on his study, he showed the effects of eating brown rice-based vegetarian diet compared to those who were eating a normal diet, and it showed that at the end of the 12-week study, that the people who stick to the brown rice vegetarian diet had a lower waist circumference and a larger reduction of HbA1c. Another reason why someone might switch to a vegan or vegetarian lifestyle is because it lowers blood sugar levels and improves kidney function. And this is because it slows the decline of glomerular filtration rate, or GFR, and it also declines kidney blood flow. And as a result of this, kidney tissue has less damage when compared to people who eat animal proteins. It also shows a reduce of kidney cyst growth and improves lipid blood fat profile of the blood. In vegetarian diets, it also helps slow down the progression of kidney disease without compromising nutritional needs. And this is because high protein consumption has been shown to potentially have harmful effects on kidneys, especially in those with pre-existing kidney diseases. Another reason why someone might switch to a vegan or vegetarian lifestyle is because it helps protect against certain cancers. So there are lower cancer rates among people who don't eat meat at all, And many people might wonder, well, is this just because they aren't eating meat, or is it because of the other nutritions they're taking in, such as eating more plant-based foods, fruits, vegetables, whole grains? And yes, those are all packed with nutrition, so this does help reduce the risk of cancer. One study shows that a long-term observational profile study on vegan diets are less associated with the higher risk of colorectal cancer. And another study also shows that men following a vegan diet were 35% less likely to develop prostate cancer. And in this group of men, the vegan diets were the only form of vegetarian diet linked with lower prostate cancer. So it wasn't all of them, it was just that exact vegan diet. In another study, it showed that if you stop eating red meat, you'll also eliminate the risk factor of colon cancer. Another reason why someone might switch to a vegan or vegetarian lifestyle is because it lowers the risk of heart disease. For heart protection, it's best to choose a high fiber and whole grains diet. And this is because in studies it shows a link between plant-based diets having a lower cause of mortality and cardiovascular diseases. A study in 2014 looked at 198 patients to investigate whether eating a strict plant-based diet could stop or reverse harmful heart disease effects. And it found out of the 177 patients that stuck to the diet, a majority reported a reduction in symptoms and 22% had a disease reversal, and it was confirmed by test results. In another study, those who adhered to a plant-based diet also had a 42% decreased risk for heart failure over the study's 4 years. And the last study I'm going to talk about that lowers the risk of heart disease is a study done by Oxford cohort of European Prospective Investigation into Cancer Nutrition. And they did a study on 65,000 people, and it showed that 19% had a lower risk of death from heart disease among vegetarians. And the next reason why someone might switch to a vegan or vegetarian lifestyle is because it reduces pain from arthritis. Plant-based diets are known to reduce inflammation. And in a study done in 2015, it showed that participants in a 2-month trial period had reductions in inflammatory scores when compared to those who had been eating diets in higher fat and animal products. And other studies have also found that diets in fat and processed meat are associated with inflammatory markers. Another study that shows that plant-based diets reduce RA and swelling. They did a study on low-fat vegan diets in different people, and it showed that people who participated in these diets experienced significant improvement in morning stiffness, RA pain, joint tenderness, and joint swelling. And like I stated before, plant-based diets promote healthy gut bacteria, and that's because you're eating more whole grains, fruits, vegetables. And some studies suggest that this is a key role in RA and inflammation, and it helps reduce arthritis as well, or the pain and stiffness of arthritis. While I do think vegan and vegetarian lifestyles are very beneficial, there are some problems that come with it. And one of the main problems would be a risk of certain nutritional deficits. And that's because when one is on a vegan or vegetarian lifestyle, they don't take in as many vitamin B12, vitamin D, calcium, long-chain N3, and omega-3 fatty acids. And this is because they aren't eating the animal products or animal meat that contain these vitamins. And so unless they take supplements, they aren't getting the nutrition that they would normally get if they ate those. In some cases, it also shows that iron and zinc status of vegans may also be a cause of concern because of the limited bioavailability of these minerals. So vegans and vegetarians also sometimes have to take iron supplements or zinc supplements just because they aren't eating the foods that have those in them. In an Oxford study, about 50% of vegan dieters showed serum levels indicating vitamin B12 deficiency. And vitamin B12 is pretty much just the essential cofactor required for the conversion of homocysteine into non-harmful components and serves as a cofactor in different enzymatic reactions. So people who suffer with the B12 sufficiency accumulate the homocysteine, and it promotes the formation of plaque in their arteries. And overall, I believe having a vegan or vegetarian lifestyle is a very rewarding and healthy lifestyle as long as you do it correctly and take in the correct supplements. I myself was a vegetarian for 8 years until I switched into eating white meat just because I wasn't getting enough supplements and I needed that more in my diet. But overall, if you know how to do this correctly and you're thinking about it, I would highly recommend it.